Hi, this is Dr. Bill Gradishar, Professor of Medicine at Northwestern University, and I want to welcome you to this Yerbba YouTube video where we're going to be discussing what are the key points that you should consider when talking to your doctor. So we'll give you some tips that will hopefully make your interaction more useful to you and informative. So we're going to go through a variety of different things that I think are important, but starting out, I think the most important tip that I can give anyone, if it's possible, is for them to come with someone else. So we may be going in a slightly different order than you might think is critical for considering your interaction with your doctor, but the reason I bring it up is with experience. So having talked to thousands and thousands of patients over the years, I know that usually when I discuss the patient's overall predicament, their situation, and what our treatment plan is, sort of my spiel, so to speak, when I go into it, more often than not, I've answered 99% of all the questions they could possibly think about asking. And I think it's important that another person is present because they're also someone who's hearing things when perhaps you as the patient are not. It's very challenging when you get a new diagnosis of breast cancer to process all the information you may hear, see lips moving, but processing the information that you're receiving is often very challenging. And sometimes it takes one or more times to really hear it or review what's been said to really understand that many of the questions you had have been answered already. So that other person who are another set of ears is critically important. They may be the note taker who's making sure that they get all the information down correctly. So if possible, always come with someone who can help interpret what you're hearing and they can review it as well with you afterwards. The second tip I would have, and again, there's no script here that says this, but this is again with personal experience. Probably the best thing to have is not 4 pages of questions when you go to see the doctor. That's a non-starter with most caregivers. We recognize that patients are anxious, they have a lot of questions they want to ask, but it's important to highlight the key things that are of importance to you. And then, of course, to listen to what you're being told about your situation. And if your questions aren't answered or you need more clarification, then to go into more detail about the questions that you have. But as you might expect, we've all experienced this on our end of things where patients come in with 40 questions, and that simply is not going to work. It's just not possible to do that. So it's incredibly important to listen to what your caregivers offer as an introduction and overview of your situation. We will certainly pay attention to any questions you have, and we want to highlight the ones that are most critically important to you and to the care that we're recommending for your situation. So I think that's important to keep in mind, to highlight the questions that are critically important to you and make sure that you sufficiently understand what the answers are. So with that said, even though I said there's an extreme, which I was saying tongue-in-cheek, don't come in with 4 pages and a legal pad and 40 questions, it is important to have the questions written down because it's very common. And one of my closing remarks to all patients when I see them for the first time is, you'll have more questions after this is over. You'll remember what they are when you're driving home in the car, and you'll, kick yourself for not asking them. So if there is something that's important to you, make sure you have it written down so that can be discussed while you're there. One of the other tips I think is important is, although you'll hear a lot of information and you may get treatment recommendations or certain steps that need to be taken in an evaluation, you may also want to ask, not just be on the receiving end, but understand the why behind those recommendations. There's even something that we've started to notice in clinic, which is again a huge irritant because people will put into Chat GPT or some other AI tool a series of questions, and then they get a 4 page printout or a 5 page printout, and they come to clinic with a 5 page printout and they want us to discuss what a computer told them. Again, a non-starter. That's not going to happen. So I think it's important that you write down the questions that are important to you and make sure you understand the rationale, the reason behind what we're recommending to you. And that is really the supportive information you need to be comfortable with the recommendations you're hearing. Another important area that has to be discussed whenever we talk to a patient about a therapy that we're recommending, and that could be the spectrum of things from surgery, radiation, chemotherapy, reconstruction, etc. There are certain side effects that go along with any treatment. There are certain things that you have to recover from, and understanding those side effects are important. We try to be as clear as we can about what might be expected, but a patient also has to have a say in that. There are certain therapies that may be recommended that a patient feels that they simply can't tolerate and they wouldn't accept. So you have to be sort of honest with yourself in assessing your own ability to deal with what might be short-term side effects, or in some cases may be lingering and last much longer. So understanding your own body and what you're able to cope with, both emotionally and physically, is important as you go through a discussion. So try to calibrate yourself with what you're hearing and make sure that you're in sync with the recommendations and what you might expect in terms of side effects. Finally, I think it's important just to, having heard a discussion about your situation, what the treatment recommendations are, what the evaluation and follow-up is going to be, is to try to put it in your own words and repeat back, not in a 20-minute dialogue, but rather a simple summary, couple sentences, so that you're clear in your own mind what the recommendation is and how the plan will be implemented. And I think as you leave the office, you'll be comfortable that you both were heard, and understand what the treatment plan and follow-up will be. If you'd like to get more information about personalized treatment paths, including the different therapies that are available that might be appropriate for your situation, tailored to your tumor biology and health profile, you can get a Yerbba report, which breaks down chemotherapy regimens, endocrine treatments, and other combinations, and provides specific information that may be appropriate for your case. And you also have an opportunity to interact with Yerbba's medical experts directly for evidence-based answers about your options, recurrence risk, or side effects from the therapy you have by going to yerbba.com. Another tip might be to rely on reliable sources of additional information. And what I would suggest is not randomly going onto the internet or into chat rooms and get overwhelmed with people's opinions about things, oftentimes that don't have any validity or expertise. But to ask your physician or your caregivers for reputable sites where you can supplement the information you've already heard or hear it in a somewhat different way. We hope that Yerbba.com provides you with some of that information that you might seek, but getting other sites that are valuable are also useful. Things like the NCCN guidelines for patients. That gives you a sense of whether the treatment recommendations you've received are in accordance with what the standards are. And there are many other sites like that. So I think it's important that you get reputable information to make sure you understand your situation. So I want to thank you for listening to this Yerbba YouTube video where we focused on tips for talking to your physician and caregiver team. If you'd like more information on this topic or others that may relate to your diagnosis, go to yerbba.com, and we look forward to speaking to you again in the future.